Hello, everyone. Thank you for taking a few moments out of your day to watch this important message. As the CEO of Thompson Health Solutions, I want to speak to you directly about the future of our company and the culture that we must build together to get there. Thompson Health Solutions has always been committed to advancing healthcare technology, but in recent months, many of you have expressed that our internal culture has not been supporting the mission the best it could. Most of these concerns are around communication barriers, limited collaboration, and feeling disconnected from leadership. Um, I just wanted you to know that I hear you, and we're ready to take action. We've been taking steps. So, sorry about the beanie. My hair is a mess, and I'm about to go shovel the driveway. So, I'm sure you guys will forgive me, but why do we need this culture change? So, for healthcare technology, it demands the highest ethical standard, not only in our products, but in how we treat people and make decisions. Right now, our culture is too hierarchical, too cautious, and not too open to ideas and leadership that all of you bring to the table. If we want to grow, innovate, and truly impact patient outcomes, we need a culture change that's going to impact transparency, teamwork, and accountability at every level. So we've updated our mission statement in order to get this moving. Currently, it is delivering solutions to healthcare technology. This doesn't really reflect who we are as a company and where we want to be. So we've decided to change it to delivering innovation, collaboration, and compassion to healthcare technologies around the world. This is more than just a sentence to me, and it should be to you too. It's a commitment to our employees, our partners, and our patients who depend on our work. To support this statement, we've also redesigned our core values. The main four are going to be integrity, collaboration, compassion, and empathy. These values should guide, and they will guide, every decision we make. From our leadership practices to daily interactions, they reflect the ethical standards required in healthcare technology and respect every employee and the respect every employee deserves. Jeez. Leadership changes. One of the big concerns a lot of you mentioned was um, leadership and staff. We're done. We're fixing it. We're going to restructure it. So, to start that, we're going to do emotional intelligence based leadership training, transparent decision making, regular team engagement, and then especially open channels for feedback. Our leaders will model ethical, collaborative behaviors we expect across the entire organization. We also need to improve our communication overall, as it's the heart of the culture. So we're gonna do this in several ways. Next month, we're gonna hold a monthly company-wide meetings so we can share progress and updates. We're gonna launch a fully anonymous feedback system so every voice can be heard without any hesitation. And then teams will also be doing more collaborative problem solving and idea sharing sessions. So hopefully that'll help and encourage communication across the board. Our organizational norms and daily practices also need to change. We're going to introduce peer review processes, innovation meetings, recognition programs for collaboration and leadership to give back to you guys because you've all been working so unbelievably hard. We're also going to do some team building events. Now, these could be like bowling or tournaments. We could do a fantasy football league, something like that. Now, this is a lot. So, to implement it, oh my goodness, it's going to be a one-time announcement, and it's kind of just going to be a consistent ongoing process. So we're going to begin with an anonymous company-wide culture survey so that we can understand what you guys need and how ready you're feeling. These training programs that I'd previously mentioned are going to follow after that, and we will constantly be doing these surveys to get constant feedback about how you guys feel, because really you guys are the company. So um, when we succeed, we're planning on seeing higher employee engagement, stronger innovation, improved communication, less turnover, a healthy, more ethical, and collaborative workplace, and ultimately just better outcomes for the patient technology. So this is not just about improving the internal environment. We need to strengthen our reputation, build trust, and also improve our positioning for THS for our long-term success. Culture change is going to take a lot of effort, guys. It's going to take a lot of commitment and openness. But I believe in you, and I believe in this company. Together, we can build an organization that reflects compassion, integrity, and innovation that healthcare technology deserves. Thank you all so much for your time, and thank you for being a part of Thompson Health Solutions.